Welcome back. Over 70% of children and youth in the country felt they needed mental health support over the past year. Now, this is according to a report by the UN Children's Fund. But just 35% have actively sought out help. Unicef is concerned by this reluctance. Unicef SA Representative Christine Muhigana joins us now for the conversation. Christine, thank you so much for your time this morning. I mean, to think about 73% or so of young people and children in this country need some kind of mental health support. I think on one side, though, I think we can be relieved at the fact that it's no longer stigmatized to be in a place where you can have, you need the mental health support. But on the other side of it is the number. 73% is no laughing matter.
Absolutely. As you said, it's good that young people, children are actually talking about it, saying that they have experienced mental health issues. And on the other hand, yes, we need to make sure that we respond. We need to make sure that the services are there. We need to make sure that as we listen to the children, as we hear what the children and young people are telling us, that they are actually a part of developing these kinds of systems that we need to respond to their mental health issues.
Yeah. You know, I think maybe perhaps, Christine, from the research that you've done, what have been some of those contributors to mental health problems amongst young people in this country?
So what we actually have now are the results of a poll. We have a platform called YouReport, and we seek out the views, the perspectives of young people. So it's not so much a research; it's sort of a pulse at a given moment in time. This one was conducted in October. So what a good proportion, around more than 30% of those who responded, what they're saying is causing them anxiety is the fact that they're not sure they have the skills to find a job. They want to be able to fit in as they look for a livelihood. Another factor is the fact that the cost of living is rising around them, and this is causing them anxiety. Third, in terms of ranking of the causes of anxious young people, is the fact that they want to succeed in school. As you know, in the past 2 years, there's been lots of disruption in learning, lots of learning lost. So that remains, a very big concern for young people. Then you have the violence in the community. You have the bullying in school also, which comes out. But the first ones that I mentioned in this particular post that we conducted, this poll that we conducted, which gave us sort of a pulse of what young people or children are feeling, is to say, we want to find a job, but we're not sure we have, the right skills. We're concerned about the rising cost of living, and we want to succeed in school.
Therefore, Christine, would it be fair to surmise that South African youth do not feel as though they've got economic opportunities in this country?
Absolutely. So the unemployment, the economic situation, the poverty in the country is for sure a great cause of anxiety, and calls for the kinds of responses that would go to the roots of some of these mental health issues. We need, of course, to make sure that when mental health issues are experienced, the responses are there. The services that respond to specific considerations or needs of children and young people are there. But of course, looking at the root causes of these anxieties, of these issues is paramount.
Yeah. And on the other side of it, of course, it's the issue around what kind of support is being made available to South Africa's young people. So if we have got public healthcare facilities which are already overstaffed, oversaturated, and you've got maybe one psychologist for, let's say, every 1,000 people or so, or uncountable number of people, you're going to take a long time before you even get an appointment to see a therapist to work through some of those challenges, right? And if you go to private healthcare facilities, that on itself is an exorbitant amount, and you have to looking at the economic economic inequalities that exist within the South African context, how many of these young people are going to be adults who have not been able to iron out or deliberate or even, air out their deepest of feelings with somebody who is a professional? I worry about kids that have not been given the space to deal with some of the mental health issues, the type of grown-ups that they will become.
Absolutely. That's why prevention is key. We don't want to be in a situation where it's too late, it's costly, as you said, whether the health system, the school system, the child protection systems are overwhelmed with cases. We need to work on a system whereby it starts, at the family, in the community. You want to make sure that children grow up in a caring, nurturing environment. You need to skill parents so that we don't get to a point where a young person actually needs the specialized care, which, as you said, is expensive. But be it as it may, once we are in a situation where these children, young people need the support, need the services, the primary healthcare system, the school system, the child protection systems out there need to be resourced, need to be capacitated to deal with the issues. We don't have a choice. The investments need to be made. But as I said, first and foremost, let's see how we can work with the government, the public system, in partnership also with academia, with private sector, so that the preventive part of it is also addressed. We need to know, when we work, for example, with the Children's Institute at the University of Cape Town, to make sure that we know what the issues are. They had a beautiful study made, mine of information, of evidence on children and adolescent mental health. We need to use that information so that the systems that are built, the kind of caring, supporting environment that happens in families and communities is there, so that we don't get to the point where we need responses that are expensive and out of reach.
Christine, we do thank you so much for your time this morning. Christine Muhigana, who is the Unicef SA representative. Just on the statistics, 73% of children and young people in this country needing mental health support.